Getting the most out of your clinical experience is simple. So here are a few tips. Number one, go prepared and be professional. So you want to review the pathophysiology of the main diseases that get admitted on the floor you'll be working on. For example, my last rotation, I always worked with diabetes patients, stroke patients, and a lot of patients who had MIs, were post-MI. So I reviewed insulin, thrombolytics, blood pressure, and heart medications, and the diets that these types of patients would need, all the good stuff. And then I would also pack my clinical bag and put out my uniform the night before. And just prepare yourself mentally for the smells, the blood, the needles, like all of that. You just never know which kind of patient you'll get. There'll be total care or what their acuity will be. So just prepare yourself mentally as well. Next, go willing and ready to learn and take initiative. Any negativity around you, leave it at the front door before you enter the hospital. Try to go into clinical with a clear mind. Say a daily affirmation before you go in, or say a prayer. Patient safety is key, and protecting yourself is equally important. So you have to do your best and be willing to give it your all. Take in the entire experience, because it's a blessing to be exposed to actual patient care and be able to prepare yourself for the real world. Next, master your physical assessment. Master it. That is your bread and your butter. If your patient assessment skills are strong, you will catch the changes in your patient, or even things that could have been missed on admission. So, know what's normal so that anything abnormal will stand out like a thorn. Also, the majority of your day will be assessments and reassessments unless your patient has specific procedures for you to perform, like inserting a Foley, doing trach care, inserting an NG tube, all that good stuff. But your physical assessment is your foundation, and do your best to be thorough. Practice how to talk to the patient during the assessment as well, because that makes it easier to complete. I personally like to combine patient teaching with my assessment so that they can understand important things related to their condition. Next, be humble. If you make a mistake, be willing to correct yourself and take constructive criticism. It is great to be confident in what you know and be well versed in the material, but you also have to understand clinical and actual practice are a lot different. And there's always something to learn, especially from someone who has done it much longer than you or I have. So take the time to ask questions and brush up on the skills that you have learned. Next, be empathetic. Try to truly understand and care for your patient. Think critically. Don't just perform tasks. Like literally, you can't just go in there and do a set of tasks. Like, for example, when you're giving a medication, don't just know what the medication does, but know why that specific patient is taking it. Like, think about it. If a medication interacts with any other meds the patient is taking, if you're giving a diuretic that will drop the BP, did you check the BP before giving the med? Like, don't just blindly go into a set of tasks. Do your best to invest time in the understanding of the patient's diagnosis and what brought them to the hospital, their past health history, allergies, social history. All of that is so important. And the more you know, the better. Like, the nurses are like detectives, so know your patient. Next, don't think too much about it. Don't think about it too much. But for real, get out of your head. Don't be intimidated. Have fun. Get the most out of your time. Like, why be in there stressed or angry or sad and beating yourself up over something you didn't know or something you did wrong? Like, no. Keep your spirits high. Have a close friend or a group of friends that you can vent to and debrief with. Support your friends in return. Always lend a helping hand if you have downtime. Or go shadow someone who's doing a different skill that you haven't done yet. But just do your best. Have a positive attitude, because it allows you to network easier and people will notice you. Me personally, I met so many directors and managers throughout my clinical rotations that literally said when I graduate, they want me to come back to their facility and apply. So come on, just be in good spirits, be willing, be open. But that is all we have for today. I hope that, you know, I uplifted your spirits, that I got your gears grinding and got you thinking and stuff like that. You know what I mean? Just do your best. Making the most out of clinical starts with being willing and being prepared and being professional. You got this. Don't think about it too hard. But I got you. So if you have any more questions or any comments, just drop it down below. I got you. We'll chat later.